Dear colleagues and dear doctors, I am Dr. Hamida Sukara, Director of the Department. Welcome you all in our weekly scientific presentation on a 55-year-old female bilateral early foundation. Presented by Professor Dr. Amira, which is organized by Professor Dr. Now I request our research Dr. Faisal Dr. Chaudhary, Assistant Professor at Head Department of Ophthalmology, and Honorable Chairperson, Professor Dr. Muhammad Hamidullah Sir, come up to the dais and conduct.
What the intern go yaar. সবাইকে আসতে বললাম একটু সবাইকে আসতেছে ফাঁকা এই সবাইকে নিয়ে আসা
আসসালামু আলাইকুম। দুর্যোগপূর্ণ আবহাওয়া এবং বর্ষণমুখর সকালে সবাইকে স্বাগতম। আমাদের অডিয়েন্স খুবই কম, তবু আশা করতেছি যে খুব অল্প সময়ের মধ্যে ইনশাল্লাহ সবাই চলে আসবে। আমাদের অপথলমোলজিতে
স্যার নতুন চশমা
আজকে আমাদের রিসোর্স পারসন আছে ডক্টর ফয়সাল কাদের শাহ চৌধুরী, অ্যাসিস্ট্যান্ট প্রফেসর হেড ডিপার্টমেন্ট অফ অপথলমোলজি এমএমসিস,
একটু পরে যাবো গা,
এবং আমাদের অডিয়েন্স প্রফেসর্স, other teachers and doctors.
বন্যা
Welcome our session.
আরে
আমাদের অপথলমোলজি
স্যার
এই বিষয়টার মূল উদ্দেশ্য মানুষকে দৃষ্টি দেওয়া, দৃষ্টিটা যাতে ঠিক থাকে এটা একটা উদ্দেশ্য। আর দৃষ্টি যদি কমে যায় এটা ফেরায় আনা, এইটাই আমাদের এইম অ্যান্ড অবজেক্টিভ অফ আওয়ার সাবজেক্ট। তো ব্লাড ভিশন বা ডিমনেস অফ ভিশন বা লস অফ ভিশন আমরা যাই বলি, যখন একটা পেশেন্ট আমাদের কাছে আসে আমরা ট্রাই করি যে কীভাবে ভিশনটা রেস্টোর করা যায়, কীভাবে ইমপ্রুভ করা যায়, অথবা অনেক সময় দেখা যায় এমন কতগুলি ডিজিজ আছে যেগুলি আমরা ভিশন ইমপ্রুভ করতে পারবো না, কিন্তু আর যাতে লস না হয় এটাকে আমরা কীভাবে ধরে রাখতে পারি। আর কতগুলি ডিজিজ আছে আমরা যতই কন্ট্রোল করি তার যে প্রসেস, এই প্রসেস অনুযায়ী সে আগাইতে থাকবে এবং আলটিমেটলি সে ব্লাইন্ডের দিকে যাবে।
এটা না শিল্প করে দেখি,
কিন্তু আমরা যদি আর্লি ডায়াগনোসিস
অনেকেই দেখি
এবং আর্লি ম্যানেজমেন্ট যদি আমরা শুরু করতে পারি
কাজ নেই বা এমনিতে,
তাহলে আমরা এই প্রসেসগুলিকে আমরা ডিলে করতে পারবো। এবং আল্লাহ রহমতে যতদিন একজন বেঁচে থাকে এই ততদিন যাতে একটু দেখে তার জীবনটা চালিয়ে নিতে পারে, এটা সম্ভব হয়, ওই চেষ্টা আমরা করি। যাই হোক, আজকে যে আমাদের বাংলাদেশে বা পৃথিবী ওয়ার্ল্ড ওয়াইড লস অফ ভিশনের যে কতগুলি কারণ আছে, এই কারণগুলি এগুলি কিন্তু কমন কজেস। এই কমন কজ নিয়ে আমরা ডিল করি। আমরা আনকমন জিনিস কিন্তু প্রেজেন্ট করতে চাই না, আমরা কমন জিনিস প্রেজেন্ট করতে চাই যেগুলি নেগলেক্টেড এবং যেগুলি প্রপার ট্রিটমেন্ট না হওয়ার কারণে একজন মানুষ ব্লাইন্ড হয়ে যায়। আমাদের চোখের সামনে সবসময় ঘোরাফেরা করে কিন্তু আমরা বুঝতে পারি না। এরকম একটা কন্ডিশন যে আনঅ্যাওয়ারনেস
শিশু যেহেতু
এবং আমাদের দেশে যেহেতু সিস্টেম নাই, আমরা কিভাবে আমাদের এই ব্লাইন্ডনেসটাকে প্রিভেন্ট করতে পারি এই সম্পর্কে আমরা ইনশাআল্লাহ আলোচনা করব। আমাদের রিসার্চ পারসন সে তার মূল্যবান মতামত দিবে। আমরা ইনশাল্লাহ শুরু করি। আমাদের 10 মিনিট পার হয়ে গেছে।
স্যার বলতে শুরু
আই
করেন।
রিকোয়েস্ট ডক্টর রৌনক কারারুলি, অ্যাসিস্ট্যান্ট প্রফেসর আওয়ার, প্রেজেন্ট দিস কেস।
Thank you, sir. Honorable Chairperson, Professor Dr. Mohammad Habibullah sir, our honorable, our respected professors, my dear colleagues and intern doctors and learned audience. Assalamu alaikum. Have a good morning. I am Dr. Rauno Karami Juli, Assistant Professor of the Department of Ophthalmology of the Community-Based Medical College Hospital. Welcome you all in today's scientific session. Now, I would like to also give a special.
আমি একটু ভুলে গিয়েছিলাম, আমাদের সেশনটা দুইটা ভাগে ভাগ করা। প্রথমে আমরা একটা কেস প্রেজেন্টেশন করব, তারপরে আমরা একটা ছোট্ট আমাদের প্রেজেন্টেশন আছে যে ওল্ড এজে বা এইজিং প্রসেসে একজন মানুষ আমাদের কী কী রোগে আক্রান্ত হয় এবং এদের কীভাবে আমরা প্রিভেন্ট করতে পারি। খুব অল্প সময়ের একটা লাস্টে প্রেজেন্টেশন আছে। সুতরাং আমরা ফার্স্ট পার্ট আমরা শেষ করে লাস্ট 20 মিনিটস আমরা ইনশাল্লাহ ওই প্রেজেন্টেশনটা আমরা করব। হ্যাঁ, আই রিকোয়েস্ট রুলি টু প্রেজেন্ট দিস কেস।
Thank you, sir. Now, for this time, I would like to give a special warm welcome to our special guest, Dr. Faisal Kadir Shah Chaudhary, who have traveled far and managed his valuable time for us to be with us in today's scientific session. Now, with the permission of the chairperson, I would like to start today's presentation. Our today's topic is a 55 years old female with bilateral blurring of vision. Now, let's get started. Firstly, the particulars of our patient. Patient's name is Hosneara Begum, 55 years old, female, married, housewife, Muslim in religion, hailing from Maria of Kishoreganj district. We examined her the 27th May 2025. Her chief complaints was the blurring of near vision in both eyes for 10 years and blurring of distant vision in her both eyes for 1 year. Now, the history of presenting illness. According to the statement of the patient, she was reasonably well 10 years back. Then she was addressed blurring of her near vision during her close work. It was insidious and slowly progressive in nature, experiencing difficulty in reading the Holy Quran and to do the near work also. She visited to the nearby eye doctors for her complaints and she was given the spectacle corrections along with some drugs. But for about past 1 year, she also developed the blurring of distant vision in her both eyes, which is more marked in right eye. Because of this utmost discomfort due to her visual problems, she was advised for cataract surgery and the changes of the spectacles. Her visual problem was associated with the discomfort and occasionally headache, but which was mild, dull-looking in nature and not associated with the preceding flashes of light, no nausea or vomiting. There is no history of ocular pain, itching, redness, photophobia or lacrimation. She also experienced halos around light. She gave no history regarding the transient loss of vision or any ocular trauma. She is hypertensive but non-diabetic. She repeatedly consulted with eye doctors, but her visual problems was not improved satisfactorily. With this above complaint, she attended to the Department of Ophthalmology for better management. History of past illness, she has no history of any previous ocular or systemic diseases except hypertension. Regarding personal history, she takes the betel nuts with tobacco regularly. She is non-smoker and non-alcoholic. She took the tablet paracetamol 500 mg occasionally and tablet Fixocard 50 mg for last 3 years. Regarding family history, she is the only child of her parents. Her father died without any known remarkable ocular diseases. Her mother is healthy. She has 1 son and 3 daughters. All are in good health. Now, the socio-economic history. She belongs to a middle socio-economic condition. Her family lives in a brick house with a sanitary toilet and drinks arsenic-free tubewell water. She is menopaused for 5 years. There was no drug or food allergy history is present. Regarding immunization history, she is immunized. She is not immunized as per EPI schedule, but she is vaccinated against the COVID-19. Now, the general examination.
Regarding history, কারো কোনো সাজেশন, কমেন্ট or query, please ask.
History শেষ হয়নি। শেষ হয়নি।
মানে এক্সামিনেশন পরে এক্সামিনেশন শেষ করে আমরা করব। আচ্ছা ঠিক আছে।
Regarding general examination, the appearance anxious, body build average, cooperative, patient was cooperative, decubitus on choice, nutritional status was average and anemia absent. Jaundice, cyanosis, clubbing, chylomicria, leukomicria and edema was not present. And dehydration, there is no dehydration, no bony tenderness, thyroid gland not enlarged, lymph nodes not palpable, neck vein not visible. And pulse rate was the 72 beats per minute, blood pressure was 140 by 90 millimeter of mercury, temperature was 98.4 degree Fahrenheit, respiratory rate was 16 breaths per minute.
Yeah, continue.
Now, the ocular examination of my patient. Her visual acuity unaided was 6 by 36, whereas the left eye is the 6/9. We corrected it with the spectacles. It is up to the 6 by 18 with minus 1.50 dioptric spherical lens. And in the left eye, it is 6 by 6 with the minus 0.25 dioptric spherical spectacles. Regarding ocular motility, it is full in all gauges in right eye and left is also. Hirschberg reflexes was central in both eyes. Now, the eyelids, eyelashes, conjunctiva and cornea, these are both are normal in right and left eye. The angle of the antechamber was also normal, and angle of the antechamber, which is evaluated by the von Herrick method, in case of right eye, both eye are open, and iris was normal in color, texture and appearance. Regarding pupil of the right eye, it is the central, mid-dilated, round, regular, and light reflex was sluggish, direct light reflex was sluggish in right eye, whereas RAPD is also present in left eye. Whereas in the left eye, the pupil is central, normal, round and regular, and indirect light reflex was sluggish in left eye. Now, lens. The lens shows the grayish white opacity, which is grade 2 cataract in right eye, and whereas in the left eye, it is also the grayish white opacity having the grade 1 nuclear sclerosis. And we also measure the intraocular pressure by the procedure of the GAT, that is the Goldman applanation tonometer. It is in right eye is 32 millimeter of mercury, whereas in the left eye is the 16 millimeter of mercury. Now, regarding fundoscopic examination, we found the media was mild hazy in both eyes, and optic disc, the size, shape was normal, margin was normal with pale color. The cup disc ratio was 0.9, oval, deep cupping, having the generalized thinning neuroretinal rim in right eye. Whereas in the left eye, it is the optic disc was normal, size, shape, color, and but the cup disc ratio was 0.7, having the normal neuroretinal rim. Now, regarding the blood vessels pattern, there was the nasal shifting and the bayoneting of the blood vessel that is present in the both right and left eye. Now, this is the color from this is the optic disc appearance of the right eye. Here we see the cup disc ratio is more in case of right eye, which is about 0.9, having the bayoneting sign, deep cupping, oval shaped cup, and whereas in the left eye, it is the 0.7 cupping, having having the bayoneting and the nasal shifting of the blood vessels also. And now the color vision was trichromatic in both eyes, and visual field test in case of by the confrontation method, we found in right eye it is reduced peripheral field, whereas it is normal in the left eye. Now, regarding nervous system examination, higher psychic function was normal. The cranial nerve examination reveals are normal except the optic nerve function. Both the motor and sensory function was normal. Cerebellar function, reflexes and was normal, and there was no sign of meningeal irritation. Regarding cardiovascular system examination, the apex beat was the left fifth intercostal space, the pulse rate was 78 beats per minute, the blood pressure was 140 by 90 millimeter of mercury, both first and second heart sounds are audible, no added sound, no murmur. And regarding other systemic examination, respiratory system, endocrine system, gastrointestinal system, musculoskeletal system, all of the findings are normal. Yes, sir. Now, my salient features of my patient. Mrs. Hosneara Begum, 55 years old female, Muslim, married housewife, hypertensive, non-diabetic, non-smoker, non-alcoholic, hailing from Maria of Kishoreganj district, came to the Department of Ophthalmology on the 27th May 2025 with the complaints of the blurring of her near vision of both eyes for about 10 years, which was insidious and slowly progressive in nature, experiencing the difficulty in reading and to do the near work also. She visited to the nearby eye doctors for her complaints and she was given the spectacle corrections accordingly. But for the past 1 year, she also developed the blurring of distant vision in her both eyes, which is more marked in the right eye, and she was given the spectacle corrections and advised the cataract surgery by the local eye doctor. Her visual problems was associated with the discomfort and occasional headache, which was mild, dull aching in nature and not associated with the preceding flashes of light, no nausea or vomiting. She gave no history of stroke, bronchial asthma, ischemic heart disease, migraine. She has no ocular pain, itching, redness, photophobia or lacrimation. She never had the transient visual loss or any ocular trauma or surgery. She repeatedly consulted with the eye doctors, but her visual problems was not improved satisfactorily. On general examination, the patient was anxious with average body build and nutritional status. Her pulse rate is 72 beats per minute and blood pressure was 140 by 90 millimeter of mercury. On systemic examination, the nervous systems are normal except the second cranial nerve. On systemic examination reveals the normal findings. On ocular examination reveals unaided visual acuity in right eye is 6 by 36, which is improves the spectacles with 6 by 18 with minus 1.5 diopter spherical, while in the left eye it is the 6 by 9 unaided, but it is the 6 by 6 with the spectacles of minus 0.25 diopter spherical spectacles. The antechamber was normal and open angle in both eyes. The pupils are centrally located, round and regular in both eyes, but mid dilated found in right eye. The light reflex direct was sluggish reacting in right eye and indirect light reflex was sluggish reacting in the left eye. RAPD is present in right eye. Both the lenses have the greyish-white opacity, having the nuclear sclerosis of grade 2 in right eye and grade 1 in left eye. Intraocular pressure, which is measured by GAT, 32 millimeter of mercury in right eye and 16 millimeter of mercury in left eye. The fundus examination reveals the hazy media in both eyes, which is more marked in the right eye. Optic discs are normal in size, shape, margin in both eyes. The cup disc ratio is 0.9 in right eye, whereas 0.7 in left eye. Having the nasal shifting of the blood vessels and baroneting signs are present on both eyes. The neuroretinal rim is thin in right eye. Macula and peripheral retina and other color visions was normal in both eyes. The visual field peripherally restricted in right eye, which is normal in left eye.
Thank you, Dr. Ruli, for presenting this case. Now his audience is open for discussion and comments and questions.
Thank you, sir. Now we proceed the proper provisional diagnosis. Our diagnosis is the primary open angle glaucoma in right eye with the glaucoma suspect in the left eye with age related immature cataract in both eyes with hypertension. Now our differential diagnoses are the lens induced glaucoma in right eye with age related immature cataract in both eyes with hypertension, the primary open angle glaucoma in right eye with normal tension glaucoma in the left eye with age related immature cataract in both eyes with hypertension. Now we do some ocular investigations. These are the color fundus photography of both eyes, gonioscopy of the both eyes, Humphrey visual field analysis, central 30-2 threshold test for glaucoma in both eyes, and OCT, that is the retina OCT of retinal nerve fiber layer thickness, and optic nerve head analysis of the both eyes. And here is the color fundus photography of the both eyes. Here it shows that there is a 0.9 cupping in the right eye and 0.7 cupping in the left eye, having the nasal shifting of the blood vessels of the both eyes and bionoting sign. And this is the ocular coherence tomography of the retinal nerve fiber layer thickness and optic nerve head analysis. This also shows the vertical cup disc diameter is more 0.7 in left eye. Now we do some laboratory investigations. We do the complete blood count, which was normal. The random blood sugar was 5.6 mm per liter. ECG was normal study. The serum creatinine was 0.9 mg per liter, and urinary routine microscopic examination was normal. Now our confirmed diagnosis is the primary open angle glaucoma in right eye with normal tension glaucoma in the left eye with age related immature cataract of the both eyes with hypertension.
পর্যন্ত থাকবে স্যার ম্যানেজমেন্টও বলে হয়ে যাবে শেষ করে দাও শেষ করে দিয়ে ডিসকাস
Now our treatment plan. Our treatment plan is to prevent further glaucomatous damage by achieving the target intraocular pressure and to treat the cataract by surgery. And regarding medical treatment, we give some anti-glaucoma medications. These are the Bimopress eye drop, 1 drop 3 times daily in right eye, Benozole eye drop, 1 drop 4 times daily in right eye, and Abaton eye drop, 1 drop once daily in both eyes. Then we follow up this patient after 1 month. We found that in right eye, the unaided visual acuity was 6/36 and left eye was 6/9. With spectacles in right eye it is 6/18 with -1.50 diabetic spherical, and which is 6/6 with -0.25 diabetic spherical. Intraocular pressure was 25 mm mercury in right eye, and in left eye it is 12 mm mercury. Then we our treatment plan for right eye is extracapsular cataract extraction with posterior chamber intraocular lens implantation with trabeculectomy with the peripheral iridectomy, that is which is called as combined approach. Now for cataract surgery we need some biometric power of our right eye, which reveals that that is the posterior chamber intraocular lens power, that is the PCIL power is plus 23.50 diabetic spherical. Then we treat the patient in right eye, that was the extracapsular cataract extraction with the posterior chamber intraocular lens implantation with trabeculectomy with peripheral iridectomy on the 6th July 2025. Then we follow up this patient after 7 days. We found that the visual acuity was 6/18 unaided, the blade was functioning, and intraocular pressure was 18 mm mercury. Then we again follow up this patient after 1 month. Here we found that that is the visual acuity in right eye was 6/18, in left eye was 6/6 with spectacles, and intraocular pressure was 16 whereas in the left eye was 12 millimeter of mercury. Then we follow up this patient after 2 months. Here we found that in case of right eye, it is 6 by 12 with minus 1.50 dioptric cylinder with 100 degree axis, and the left eye was 6 by 6 with minus 0.25 dioptric spherical power. Intraocular pressure was 12 millimeter of mercury in right eye and also in the left eye. Now, further treatment plan for left eye. This is a combined approach. We plan for combined approach, that is the trabeculectomy with extracapsular cataract extraction with posterior chamber intraocular lens implantation for the left eye. Then we follow our follow-up protocols. It will be after 6 months interval. We should evaluate the patient by assessing the visual acuity, measuring the intraocular pressure, doing some investigation like optical coherence tomography and visual field analysis to prevent further damages.
মেসেজটা পরে দিই স্যার। ঠিক আছে, থ্যাংক ইউ ডাক্তার রুলি ফর nice presenting this case.